Today's topic is very interesting. So it is regarding your balance system. So if you have elderly at home or anyone you know who has a balance issue, definitely you can ask for free advice here. No need to pay one, huh? All right, so give it a share before I invite my speaker. Okay, so we got. All right, so we got Ayao, we got Ho Can Chu. Anyone else? So there's 3 people only. Let's invite more people, guys. There's 6 people now. I'll give it about a minute or two before we invite Jennifer, yeah? So if today you have any questions regarding balance system, please do drop it in the comment section because this is a free of charge service. So just ask whatever you want. Or even if you have questions about hearing loss or hearing aids, you can also put them in the comment section below. Hello, Xiuling. Hello, Patricia. Okay, so I think we're ready. Yeah, can you guys share it? Share. Let's get at least 10 people to watch. Yeah, it's not easy to invite Jennifer to do this Facebook Live. Let's get at least 10 people to watch. Okay. All right, we got 10 people to watch. And now we are going to invite our guest for today, Jennifer Yi, a senior physiotherapist, also a founder of Excellence Physiotherapy Center. Yeah, that's right, in Miri. Yeah, so we'll let her introduce herself because she would know better about herself than me. Correct.
Hi everyone. My name is Jennifer. I'm actually a physiotherapist, graduated from UKM 15 odd years ago. So yeah, we started Excellence together with my 2 other colleagues in Miri 2 years ago. Yeah. So that's me as a physiotherapist. My special interest is actually neurology, stroke. Yeah. But it's okay, we'll be talking about balance because it's also very much associated with neurology. So yeah, it's okay. What do you want to ask?
So what are we sharing today?
Oh, okay. So I'll be talking about balance disorder because I do feel it has a bit of relation to whatever you guys doing. Whatever you guys are doing in terms of hearing, yeah. So I'll be sharing about balance disorder.
Okay, so balance disorder, is it like very common among elderlies or very common among people of, I don't know how many,
Yeah,
how old?
definitely. In elderly, you do see a lot of cases of balance issue, and then that's one of the reasons why fall happens. In fact, statistically, right, in Asian adult, there is a statistic that says that 1 in every 4 adult actually fall every 20 minutes. This is a study done in one of the in an Asian population study among the elderly lah. When in America, actually, they found out that if someone fall twice in their lifetime, they'll be likely to fall again. Yeah. So balance is a disorder caused by many factors lah. Yeah. So when you feel imbalance, you tend to alter the way you walk.
Yeah, true.
The way you stand and the way you do things around you. Well, it's a little bit complicated because balance is, as we know that when we feel imbalance or when we feel like we are not secure doing things around us, we tend to try to be rigid.
Yeah,
we try to be rigid.
Lock ourselves in the spot, right?
Keep ourselves close to the center of gravity. So this is because of the 3 factors that mainly control our balance, which is our visual, our eyes.
Okay,
Yeah,
our
if
vision.
we can't see properly, we will not be so adventurous to reach out for something.
Right.
Yeah. And
Yeah.
if you can't hear properly, or I mean, if you know your vestibular, your ear has some issue,
Yes.
your has some issue in your inner ear, then you feel like unbalanced. You feel
Yeah,
like you're not
correct.
walking in a straight line.
Yeah.
Yeah. And also proprioception. Proprioception is basically joint sense. It's something that physiotherapy use a lot, because the word proprioception, we will not only tell the elderly, even the younger people. It's like your joint sense, your ability of your foot, your feet, to actually feel the depth of the ground, your sensory. So yeah, a lot of things that affect this lah. So yeah.
So it's kind of like for the how do you pronounce it again?
Proprioceptions.
Proprioception.
Yes.
Yeah, proprioception. So it's kind of like closing your eyes and you knowing where your elbow is and things like that. Is
Correct.
it? Right.
So if I give you a simple example, if a younger person, if you tend to kind of like if you injured your ankle in sports, if you don't do a proper rehabilitation, you find that after a while when you start walking and not looking at where you are going, you tend to like your ankle tend to like give way. Yeah. That is because the ankle did not go through like proprioceptive training.
So you still don't feel it.
That's
right
why
way,
people happen ankle injury, although people think that's a simple injury. But I really pay focus on it, because re-injury tend to happen. Similarly with knee as well.
So we heard like people with knee injury or ankle injury always has a recurrent injuries and things like that.
Yes. So we do not deny that as this person gets older, and when the proprioceptive mechanism is not working properly, or degeneration happens, then it can affect their balance. Yeah,
that's true.
Okay.
And then also, we talked about fall being very common among elderly.
Yes.
Yeah, I agree with that, because even in hearing aid nowadays, for example, like the one that we have in our clinic, they actually introduce new features to detect fall.
Oh, cool.
So it shows that how serious this fall issue actually is among elderly. So let's say if it is a very common occurrence, right, among elderly, how do we actually prevent it?
Oh, okay. Before we talk about prevention, probably I can go through a few of the causes first.
Yes, let's go. Yeah, true. Go causes first before prevention. So causes first.
I think prevention is good, but we need to identify the causes, the factor that might contribute to fall or to the imbalance, so that we know how to handle it. So so of course, when you have vision or vestibular problems, you need to manage it. So balance, people have vestibular problems. Sometimes they have this vertigo. You think like everything around your room is spinning.
Yeah.
So that's one of the causes of imbalance as well. So this one needs to be addressed.
Yes, correct. That
Needs
is
to be
true.
addressed by medication or what sort. And also one common issue is the foot issue. Yeah,
Foot.
your structure, your feet.
Okay.
Your feet. Sometimes when someone has diabetic, they will have reduced sensory on the foot. So then the proprioception and the sensory will be affected. So they do not really feel the ground.
Yeah.
Yeah, they'll feel numbness and all that. So that affects balance as well.
Right? Because they cannot feel like how where they're
correct.
stepping.
There are some of our patients that we realize that when they're having a lot of cocktail of medication, they are taking a lot of medication, like one medication. These somehow also affect their balance.
Oh, really?
Yeah. Because it's on too much drug, so there's a lot of side effects happening in their body. So they do experience.
Does that include vitamins?
I'm not sure about that.
Supplements.
But the list of the prescribed medication is also a whole lot for some people. So this you can really see that. And then of course some of the causes is hazard around your environment. Yeah. We like dimmer lights nowadays. We like beautiful carpets.
It's a
around
romantic environment.
Slippery floor. So all these are actually hazards. There might not be many elderly watching us today, but I hope that whoever is watching could actually note some of the information that we're both sharing today and maybe share it with your friends and family. A little bit of changes actually can help. Yeah, if you know the cost and also how to prevent it. Another thing is, of course, the footwear issue. Nowadays, we're not talking about elderly, but younger people, we like to have fashion shoes that's not very supportive. You just put it on, So sometimes when you look at the sole of the feet, there's even no grip. Yeah, so that will affect the balance as well. And then also, if someone has positional low blood pressure, some people tend to when you squat, you get up, you do feel dizzy and all that. So these are some causes of it. Yeah, and then the good news is we can actually prevent it with few strategies. So for example, like if you fall, in case, we can't avoid falling. Right? When you fall, don't get panic, yeah. First thing, don't get panic. Just stay calm, and then look around you. You can tell that to your elderly lah. For us younger people, I still consider myself younger.
Yeah, you are young lah. Come on.
So for younger people, I guess we are okay. But what we can do is we don't panic. So look around us, assess our injury first. Yeah. Assess, look around, assess our surrounding. If we think we can get up, we try to get up by holding onto the floor, pushing yourself up. But people that around the person, if they are elderly, try not to pull and drag the person up. Yeah, like really, really pull, because you might,
But then, let's say, I think it's like a first response. Like you see someone fall down, you try to pull them up, right?
But just hang on for a little while, just give it a pause, look at the surroundings, assess, and then only think of how to lift the person away.
So you don't go straight away
straight away that you drag the person up.
So remember that, guys.
Yeah. So and then if you try to get up but you can't, don't force it. Because that means perhaps some bones are broken or anything like that. So that's the time where you call for help, call for ambulance.
Okay.
Yeah, so that would be some of the things that can look through. And then also one of the causes is also the environment, like I said just now. What we can do is we actually, if you have elderly at home, I highly, highly recommend it not to have any carpeted floor at homes.
I thought carpet would be good. Like for example, if he or she fell on the floor, like there's a absorption, no?
But the absorption and the risk of falling, I think the risk is higher because the edge of the carpet can come off. They get kicked.
So that just changed all what I thought. I thought carpet would be good.
Unless the whole house is carpeted, which is very rare in our country,
very rare, hard to clean.
So if it's like certain place that has carpet, then you kind of always people trip on the end. Like for example, I have most of my cases, fracture cases among elderly, they don't fall outside in the kopitiam, but they fall at home. Because house is like something, you close your eyes so you know how to walk in your house, right? But when this happens, as I said, perception, eyes, you tend to not focus where you're going. That's when they trip on all these carpets and all.
Even in front of the toilet, in front of the toilet, we try to get carpets on.
The slippery mat.
The slippery mat. The whatever we call it, the carpet. The mat in front of the toilet door.
Correct. So a lot of people fall in front there or in front of the washing machine because they don't want the washing machine to be slippery. So they put a cloth in front and then they trip on the cloth.
That's so counterintuitive. So you don't put clothes in front of wet floors, on wet floors or things.
You have to wipe the wet floor first, but don't put the cloth there
for you to wipe dry your feet.
Just be careful.
Okay. Now we know. Now we know.
Yeah. So if someone who is elderly, also I myself would recommend them not to use a bar soap. Yeah, instead to use a liquid soap, because when they shower, if you are in standing and then the soap fell down, and you need to actually bend and then pick it up. So if elderly has hypertension, on so much drug, easily falling.
Yeah, right. Because they had to bend down
Bend
and
down and pick up the stone.
more
Yeah.
movement in the.
So yeah.
Yes.
Some ways will be just keep moving and stay active. That's the best way. And then I think I would recommend people to do Tai Chi
Actually,
because it's economical, cheap, easily available, and slow.
yeah.
Yeah.
But is there a way like for someone to to test if they have balance issues or not at home?
Yes, you can actually do some balance tests at home.
Mm-hmm.
But the one that I'm going to share with you all today
Mm-hmm.
is just a pre-assessment, like what is safe for you to do at home. No? Yeah, okay. What is safe for you to do at home?
So it is safe for any age, lah. Like for example, if I have my grandma who wants to do this, also can.
Can, yes.
Can.
So it's something like home-based sort of testing. But when you come over to the center, of course, you will do something more different.
We'll ask more about it later. So are you going to show us how to do the exercise today? Or?
Yeah, we're going to show you how to do the balance testing at home. It's not like a baseline sort of test for you to try out at home. If you're going to try out with your parents or your auntie, uncle, just watch out lah, and make sure you have something to hold on to. But you'll be surprised, even the younger people don't really have a good balance as well.
Maybe
you can try. I'll do it on you.
Okay, we'll try it after this. Okay. So what do we need? Do we need any special tools for this test?
Not really. You can have something like a chair.
Okay.
A sturdy chair in front of you.
Okay, so we're going to do it now?
We can do it
now. Do it now, huh? Okay.
Okay. So since you are the one doing it,
okay,
so I'll give you instructions.
Do they need to see my legs or feet or?
Yeah, that would be good.
Okay, I'm gonna adjust this, guys. Okay.
I think that's good.
Yeah, there we go.
That's good. Yeah.
Very good, huh? Okay. Don't have to see my face. I just look at my body. Okay.
Okay. So what you need to do now is
Okay.
Alvin, what you need to do now is not to hold on this thing, but the chair in front of you is just like to in case you fall, you catch the chair lah.
Okay.
Right?
So this is a safety net.
Yeah, safety net. So you try to put both feet together.
Okay, both feet together. Huh?
Yeah, and then.
Wait, hold on. Let me just go here a bit. There you go.
Okay.
And now you can see my feet. Yeah.
Cool. Now you put your feet together, and then you close your eyes.
All right.
For 30 seconds. So you're going to count for 30 seconds lah. All right. You should be able to hold this position without swaying for 30 seconds. If you can't, then there's something wrong with your balance.
Is it normal to feel a bit
like
a bit floaty?
Yes, 30 seconds. Yeah. So if you pass this one, then only you can go to the next one. So a lot of elderly that we see do not even pass this stage.
Yeah, this feels like very, very, like you feel like you're in a boat.
Yes. Okay, that's good.
Okay.
Now, can you do a tandem standing by putting one foot in front of another foot?
Okay.
Correct. And then don't hold.
Okay.
And then close your eyes, and then you're going to count to 30 seconds again. Okay. If you can't reach, the person sway, or like off balance, then the test stop lor. Normal is 30 seconds. Yeah.
Very hard, guys. It's not as easy as you think it is.
Yeah, you can try this. Yeah, so you do a tandem standing and close your eyes. You should be able to do it for 30 seconds.
So it doesn't matter if I use my left or right foot in front.
Doesn't matter. Yeah. Okay.
It's just my foot issue lah.
Yeah. So see, when you can feel like your ankle going left, right, left, right. This is proprioception.
Okay.
your small ankle muscle, trying to maintain your balance. That's 30 seconds. That's very
Okay.
good.
All right. Okay. Okay. What do we have next?
All right. Now, so, like we technically every day our tasks, we don't just stand straight, right? We
Yeah.
need to reach out something, carry out something. So this is more dynamic testing. So you're going to stand like normal.
Okay.
Okay. Try to reach forward
Mhm.
as far as possible.
Do they need to see my feet?
No. A little bit. Yes, correct.
Can I hear?
Okay. So you try to kind of like reach forward.
Okay. Forward.
Yeah, try to reach forward. Yeah, as much as possible. So Alvin should be able to reach like 25 centimeter forward. So we need to measure from where he starts to about where he ends. Yeah, that's about 25.
That's it, man. Hopefully, okay.
Okay. So that's one of the testing that we do as well. Okay. So all these tests are actually inside a test that is standard test that is done by a lot of even doctors, physio, OTs. Yeah. It's called the Berg balance test. Okay.
Okay. Let's say if a person failed this test, then what's next? Like, what do we do next?
Okay. If the patient comes to me, we will talk about this.
Let's get this out of the way.
Yeah. So if a patient comes to me with those issue in the balance, and then we will progress to the next thing where we do subjective assessment. We ask the patient a few questions, especially related to their activity of daily living. Like, for example, when you sit down and get up from your chair, do you feel unbalanced? You feel like falling forward or backwards? Can you reach out in your cupboard to get something? Or when you go out, in and out of your car, stuff like that. And then find your ADL, we call it the activity of daily living. We ask this question, and in our mind, we sort of like score it. Yeah. So if we realize that, this person has issue by asking that, especially in terms of the daily activity, because this is crucial stuff. Going out in a car, sit and stand, reach out to get the clothes in the cupboard, and then even like going for social activities, go and drink with their friends. It's also difficult for me to climb the curb. Yeah, I feel like falling. So when we ask this and they have issue, then we think about, you have issue with your eyes when you have last checked your eyes, and they say no, I don't. I have cataract. When we think about, okay, then tell them to go down to see their eye doctor, and we ask them, you have problem with the hearing normally, and if they say, we didn't do anything about the hearing, that's when we recommend them to go and see people like you.
Because hearing loss can also increase the risk of fall, because a person who cannot hear well will have will lose their audio cue. So because sometimes people use their ears to kind of like, okay, I can hear the fridge there, I can hear this TV here. But once the hearing fall, there's a hearing loss, so the things sound further, but actually they are very close. And another theory also is because a person needs to use more effort, effort to listen, and then our brain is actually like a memory card. So once you reach that limit, so then you have not enough memory for other stuff. For example, like the proprioception. Proprioception. Yes, things like that.
So we do our assessment by asking, of course, objectively, every day. And then also as a physio, we also go into depth on looking at the strength of the muscle, the range that they have, or any previous injury that they have. So we look into that as well. So then we treat accordingly. For example, if there's a muscle wasting and muscle weakness, we set an exercise program for them to do it at home and also here.
So is it like a personalized treatment for everyone, or is there like a certain standard to it?
I wouldn't say there is a certain standard. Not saying everyone come in, balance problem, Jennifer, I will do this. No. It's very like person. How to say? It's individualized. Yeah, you do assessment and then it's based on your goal. Let's say, one patient, uncle, balance issue, say I keep on tripping and fall. So, but I want to go to a movie. Then we think about how ways to improve it. Maybe using, maybe I have to check on his walking aids that he's using, something like that. So we look at that person holistically, lah. But some people say, oh, I tend to fall once, in a month, and then I have this walking stick at home. Do you like to go up? No, I don't like to go up. Then we don't bother. We don't bother about pushing him to go up in the house. Okay, then we think about exercise that he can actually do at home. Something like that.
To help him
Yes.
to cope with it.
Yeah.
Yeah. So, are you going to show teach us some of the exercise that you can do at home to improve our balance perception? Isn't it?
Yes. Yes. I can actually show Alvin and everyone some really simple exercises to do. I think it wouldn't really benefit a lot of the younger people because again, we need to challenge our balance. Our balance quite good too lah.
The test just now was also quite hard already. I don't know if I have balance issue or is it just normally hard. Can you guys try and then leave down the comment below? Is it hard to do that? Because I felt it was hard.
Okay.
But back to the exercise.
So I'm going to show really simple exercises to do. It might not be very useful for younger people, but you can actually modify it by carrying weights or tying an exercise band in your leg, to challenge your balance further. But what I'm going to show is something useful for you to teach your elderly at home. Yeah. Step number 1 is actually have something to hold in front of you, and then do a side step, and then lift off your hand. Yeah. Put back your hand and then do a side step.
Okay, hold on. Kishan, can you put me my this video up? I'll just show them. All right. So okay. So there's 2 cameras. Okay.
So you do hold and then a side step and then lift off.
Yeah.
All right. Hold, side step, and lift off. If you're good at doing this, then what you can actually do is properly let go and then just side step. Yeah. Okay. Side steps slowly. And if you're really good, just close your eyes and then try to do this. This is when you will really feel that all the muscle and then your ankle have to work really hard to actually guess how far you need to go. Alright? That's exercise number 1 and how you progress it. Okay? So exercise number 2, I'm just going to show you. If you're good, hold and then lift off one leg and let go your hand, put back and come down. Okay? Lift off your leg, one leg, let go, come down. Right?
Okay.
Okay? Lift off, let go your hand, put down, come back. Yeah. And when you get better and you think, oh, this is too simple, this is easy, so we challenge by lifting off, letting go your hand and count 5, 4, 3, 2, 1. Yeah.
It is hard. I think it's gonna be hard. Yeah.
Yeah. It's not easy. Let go. 5, 4, 3, 2, 1. But remember the test that we did just now, the normal value is actually 20 seconds. So, I should be able to do this in 20 seconds.
Let's say if I become good at doing this, does it mean that my balance is going to get better?
Yes.
So let's say if you have balance issue, if you do this exercise, you get better at this. You should.
Yeah, you should be able to feel better. The thing is, you need consistency in doing this. So very simple way to actually show how balance is part of the exercises among the athletes.
Yeah.
Yeah.
Right.
Balance exercise are part of their regime. If not, they won't have the balance to throw a javelin.
Yeah, the
Or doing
power
a short
distribution or
flip.
everything. Yeah.
So balance is part of the gym. Yeah. So that is a very prominent area in physiotherapy among the sports people. Then you can see the importance of balance for them in sports. That's why from daily activity also we do need to incorporate some balance exercises as we grow older. Yeah.
Okay. Okay. Pretty nice. Okay. All right, guys.
Okay.
Okay. So we'll get back to our seat. For. Okay.
Okay.
This is another trick. All right. Okay. Okay. Let's just adjust this.
I hope whatever I'm sharing is helpful.
I think it is very helpful. Like seriously, if you have elderly at home, get them to do this balance exercise. Like if they don't want to do it with them. You know, force them to do it. Isn't it? It will help them with the balance, right?
Yeah.
Yeah.
Force
You're not forced,
there's strategy to even force.
Okay. Okay, there you
What
go.
I do as a physio is I kind of like show the limitation that they have first by doing the test.
Okay.
And then when I always start my session with very simple exercises, easy to follow.
Yeah.
And I make them do for about a week every day
Okay.
before I progress to the next one. That's one good strategy to do. Start something simple first, easy to follow. I mean, if it's very complicated from day one, nobody's gonna do it.
Yeah, just like going to the gym. If you go to the gym and suddenly ask you to carry 100 kilo, next day you won't carry it.
Yeah, true.
Right.
So yeah, consistency. And also now what we try to do is we do have like equipment, Fit Me, like a computer based equipment.
Yeah.
I didn't get to show you, sorry, but whenever patient comes here, these are some of the things that we do. We use like computer guided equipment, like playing games.
Yeah.
To help with so that it's not too boring.
Yeah, every day like just stand there like staring at the ceiling.
So yeah, because when you do exercise here, you count to 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then you move on to the next set. But when you use computer guided, sort of exercise, you didn't realize it's 2 minutes already, and you're doing 100 repetitions.
What 100?
I mean, 100
okay, example.
Example, yeah. That's one of the ways to do it. So yeah, things like Nintendo, Xbox, they do have a lot of games.
Yeah, even like for exercise nowadays, like they got like Wii, those
have to be fun.
Yeah.
Okay. Do you have questions?
Yeah, so I'm gonna have a look at the line. Let's see if we have a question. Yeah. Come on, guys, ask some question. Free consultation. I tell you. Okay, so we have one from Open Chew. Okay, so may I know what are the signs of symptoms of unbalance?
Okay. It's actually that's a good question, but it's actually quite broad. One of the classic signs and symptoms that we can most my patient will share is when I sit down, very hard to get up. Yeah,
when I sit down,
very hard to get up. Like I need to push myself, or I need to hold on to something to pull up. That's one. If the younger people, like around their 40s or 50s, they will say, when I squat to reach out the plate in my cupboard, very hard for me to get up. Before, I'm okay.
It's not back problem.
Oh no.
It's actually balance problem.
They don't have any back problem, but they will tell you this kind of stories. This is where I will capture this sort of problem. Then I will exclude whether it's a balance issue or not. Yeah. These are one very common one that they will say, but the very obvious one, what is it? The very obvious one, if the sign and symptom is when you see the person walking, you tend to see they are leaning to one side or they're not walking really on a straight line. That one is very obvious.
Really, like just a bit, like by a bit, like I don't know. It's quite hard to. But there's very simple, obvious one.
Yeah,
You can
that
see that they're going like
Yeah,
one way.
yeah, there are some, or sometimes this is not very common unless you are physio, maybe you can catch it. But people who have balance problem will normally walk either slowly,
Mhm.
yeah, because they're scared they're falling, or they can walk really fast because they don't want they how to say, they don't have the ability to stay
Stay
longer
one-
and one
spot.
space for a long time.
Maybe.
Walk quick.
So walking fast doesn't mean that they are very Rajina. Doesn't mean Rajina.
Not everyone,
Yeah.
not everyone. I have to say that it's not everyone, but uh we pick this
Yeah.
up
So one of the strategies that they have to counter
to counterbalance, and
yeah.
then they walk very
walk
fast.
very fast. So they don't have to like
Yeah,
balance outside.
that's why they do this very fast.
Yeah. Okay.
Okay.
All right. Very good question. All right. So next we also have a question for Paul. Thank you, Miss Paul. Talking about fall, some elderly will wear shoes inside house as their foot pain. Is it recommended?
Yep. Yes, I would highly recommend that using shoes in the house, especially when now houses are mostly made with very hard flooring, like tiles like that. So as they grow older, sometimes their skin get a little bit more fragile, yeah, and then their sensory lessen, maybe due to medical issue and whatnot. So yes, wearing a proper shoes at home, it is really helpful because it helps to absorb some of the pressure from the feet structures. Yeah, but try get something that is more secure, well fitted shoes.
What kind of shoes should the elderly wear? Is there a specific like maybe rubber shoe or maybe a slipper? Say any
Rubber that have a good shock absorber will be good. Yeah, and it's not too tight.
not
It's
too
very
tight.
supportive around it, and it's not too rigid as well. Yeah.
Something that is easy to wear as well.
Yes. Yeah. If you realize that certain elderly, if you have the normal slipper where you have like a hook, like a flip flop, yeah, very hard for them to maneuver into the shoe because there's ability to do this.
Oh, so their feet cannot actually do this.
Just and kiap the flip flop. Yeah, that is also one of the finance system. So they tend to prefer a shoe that just slot
Slip,
in.
yeah, like slip in.
Yes.
Oh, okay, alright. So try to get shoes that is
So when you have like a flip flop, you tend to like grip the floor
they
better.
kinda
Yeah, they need to wiggle their way through.
yeah, never know. All right. Okay, hope I answered your question. So it is recommended to wear shoes in the house. Okay, so we got what else? Okay, Jennifer, is a patient got balance issue due to PGPV? Is it possible to be treated with balance exercise?
Yeah, possible.
Yeah.
Yeah, there is this area in physiotherapy that is quite specific. It's called the vestibular rehabilitation.
Audiology has one as well.
Huh?
Audio has one as well.
Yes. So we tend to work together with doctors and audiologists for managing PPV. But as physio, here in the clinic, I tend to not do manual maneuver too much because it can be a quite nerve-wracking experience for them when it can provoke the symptom and then sometimes they can get vomit. So I will normally handle the situation strictly together with doctors that is managing the patient. The cocktail of drugs that they're taking, and then I will also exclude any neurological issue before I start the treatment. So I will do step by step the exercises. Yes.
Rule out all the okay. I hope we answered your question. Yes, there is.
Yes, there is something called vestibular rehabilitation.
Yeah.
And
please.
Yeah, and it is also good to learn. You might not need to go for every time for the therapy session. It's not like a lifelong thing,
Yeah.
But it's good for you to learn the strategy or those sort of exercise that help you to relieve the symptom, and then have that exercise as like emergency kit.
Just in case
It will happen, then you know how to ease off the
vertigo.
the vertigo that you feel. Yeah.
Okay. Good question. Keep them coming, guys. All right, so we got the next one from Patricia. Can kids get balance problem too? Have you seen any cases like that before?
Kids with balance issue, I normally and typically see in children with special needs. Yeah, children with special needs that we are seeing here in the center, mostly managed by my occupational therapist. This is totally unrelated to hearing. Yeah. Although there might be hearing component coming in, that one has to be excluded. Vestibular. In a normal kid, surprisingly nowadays, I do not know really whether it's really purely balance or because of lack of activity. I do find children nowadays tend to be a bit more lack of activity. Like they spend too much on the phone, so there's not much of a gross motor, movement. Yeah, so they tend to be a little bit off balance all the time. Yeah? Even like I ask them single leg hop or jump from a little 6-inch stool down to the ground, they have difficulties. But after training them for a while, they are okay.
Could it be the diet as well? Like like how our food has changed over the years?
This one I'm not sure. But yes, due to lack of activity and different sort of things that we do today and before, that really shows. And I'm quite worried, to be honest, because I also have kids, kan?
Yeah.
So yeah, I see younger child is not very active. So that you can see they have balance issue. When they run, they try to trip. Yeah.
Okay.
But if they are normal child, then it's easily to handle because they are still growing. Yeah. Thanks for that question.
So I think any more questions, guys? Come on. Give me some questions. So okay, so before we go, okay, so there's no more question. I have a last question.
Huh?
I have one question. Okay. So everyone has a question. I also got a question.
Okay.
Yeah, so let's say if a patient with balance issue comes to your clinic, what would you do? What am I supposed to,
what's your expectation?
Yeah, expectation. What should I be ready? Should I eat before I come? Should I do extra stuff before I come? Things like that.
Okay. That is a very good question. Usually, I don't really get patients straight away coming in to see me. Jennifer, I fall twice a month, or I have balance issue. Very specific.
Okay.
I don't get that. But they will come to me, like what I said earlier. They said, Jennifer, I find it difficult to get into my car, or I feel very tired, or I feel it very hard to go down staircase in my house, thing like that. Do you feel pain? No. You just feel weak. Doesn't want to go, like that. Yeah. So then what I do is I will run my assessment, subjective, when I ask question.
Yeah.
Again, in my mind, thinking about their daily activity. Always, because that's what human does not function, right? And you can't be sitting down here.
Yeah.
And then physical assessment, where I check their range, their balance, their strength, and all that. If I do find red flag or abnormality, I always send them for imaging or doctor consult. Yeah. But if not, then I will set a program and then explain to them my findings.
So you will send them back to doctor first, or then doctor will send it to you. Like how does it work, like the process? Should I go see doctor first, or should I go see you first?
Usually we would advise someone to actually see a doctor first. Usually, but we do have a lot more people walking into us directly. So we can see the patient as well directly, but there are 3 things that we will exclude when you come and see us directly. If you have a recent fall, let's say you come telling me that you just fall yesterday, and then your arm is really swelling, I will not see you. I will send you to a doctor for imaging first, because I can't move if it's a fracture. I wouldn't know.
You can rule out all the injuries.
Yes, and then another thing is, if you tell me I have both hand or both feet numbness, I will not treat you here without an imaging and doctor consult, because numbness indicates neurological issue that we need to rule out. Yeah, both hands, both legs. Okay, and third thing, is if you tell me that after you fall or these 2 days you could not control your bladder and bowel movement,
Oh, that is serious.
yeah,
That's
then
very
I will not
serious.
be seeing you as well, because you can have cold diarrhea. Yeah, it's a symptoms for your lower back. Yeah. Okay, so these are the 3 things that I would not see in my clinic. Yeah.
Okay.
We have question more?
No, that's all from the question from the audience. But before we go, I'm just gonna talk about our latest promotion.
Oh.
With our ear mall.
Cool.
All right, so we have our ear mall promotion getting extended. So it is RM35 right now until the end of December. So if you are still using your old ear mold, you know what to do. Come to Best Hearing Aid Center, any branch in Malaysia. Tell them you want to make a new ear mold with this promotion. Right, so get it while it lasts, right? Because this is a really good deal. You won't find this anywhere. And yes.
Now my turn to ask you, what is ear mold?
Ear mold. Okay, ear mold is basically just a mold of your ear.
Oh.
It's like, when you use your earphone, right? You got this plug.
Okay.
You plug into your ear, but it is not as tightly sealed to your ear canal.
Okay.
Okay, so we make like a
mold.
Yes, what do you call it? Specialized, personalized mold.
Okay.
As the head of the earphone, kind of thing.
Interesting.
Yeah, kind of like gigi palsu, like gigi palsu.
So who is that for?
That is for the person who is wearing the hearing aid. Okay. So ear mold, guys, very cheap. You won't get it anywhere else. All right. So I think that is all from us. Do you have anything else to add on?
No, I'm good. I'm really thankful for Best Hearing that Alvin and his team really come here all the way to Excellence to actually do this interview and evening talk, I think.
Actually, I should thank you. You are very busy. Yeah, she is very busy. So make an appointment. Yeah. She's very busy, and she actually gave me an hour. So almost there, guys. Almost there.
Okay. So yeah, I mean, it's really good to actually speak to everyone, even though you guys are not in front of us, but and this is recorded, I think.
Yeah, it is recorded. We are going to post it.
Yeah, and then if you have any questions, I will also answer you even though it's online.
Yeah, drop in the comment section below.
Yeah.
All right. I will forward it to her.
Okay.
Okay.
Thank you.
I think that's all from us.
Bye.
See you guys next time. Bye bye.